Welcome to the Bristol Royal Hospital for Children. You are watching this video because your child has been admitted to one of our wards, and we want to keep your child as safe as possible whilst in the hospital. Your nurse will show you around the ward you and your child are staying on, and will show you where to make a tea or coffee and where to go to the toilet. Please ask your nurse if you haven't been given a welcome leaflet for your ward. Your nurse will tell you the current guidance for visitors, but any parents that are present will need a green name band provided by your nurse, which must stay on for the duration of your stay. If it comes off or fades, please ask us for a new one. These help to keep your child safe by enabling you access onto the ward. They will also allow you in and out of the hospital out of hours. The main doors to the hospital close at 10 p.m. and reopen at 6 a.m. Overnight access is through the emergency department on level 3. When coming into the ward, please don't let other people walk in behind you, even if you know them. We need to check who each person is coming to visit to keep all children on our wards safe. Each bed space should have a call bell to call for some assistance, should you need it. The nurse will show you where it is. There may be lots of noises and alarms when your child is in hospital, but we will try to keep these to a minimum, especially at night. Fire alarms are tested once a week. If you hear a fire alarm, do not panic. It's usually a test or a false alarm. If you do hear a fire alarm, please stay with your child and wait for further instruction. There may be times when the hospital is locked down. You will be unable to enter or leave the hospital or wards at this time and will be asked to stay where you are. Our aim is to reduce movement around the hospital and to keep everyone as safe as possible. There may be times when you need to leave your child. If you do leave, please let us know your child will be on their own and ensure the curtains are pulled back or the door is open if not infectious, so we can keep an eye on them. If they are in a cot, please ensure the cot sides are all the way up to the top. If your child is in a bed, the nursing staff will show you how to use the sides if it's appropriate for your child. We ask that your child sleeps in the patient bed only and not the parent bed. If you have any concerns or questions, please speak to your nurse. If you don't feel confident adjusting the bed or cot sides, then please ask the nursing staff for a more detailed demonstration. We ask that you keep your child's bed space clean and tidy, as we need to get to the bed. Only one parent is permitted to stay overnight. We advise you and your child to wear shoes when walking around the bed space, the ward and around the hospital to prevent falls and injuries and to reduce the spread of infection. Please don't let your child climb on any of the equipment or furniture for their safety. There may be times that you are not present where your child may need procedures, such as blood tests, to ensure they get the best care. Your nurse may ask you for consent that you are happy for these procedures to be carried out whilst you are not here. Thank you for taking the time to watch this short film. During your stay, please take the time to fill out the Family and Friends test card. This is a feedback form that helps us to make family hospital admissions a positive experience. Please remember you can ask us anything at any time, and if we don't know the answer, we will try to find someone who does.